We live in a state with a tremendous growing population, and we have probably for a decade or more realized that we have a tremendous need for better access for behavioral health services.
That's why in 2019, House Bill 1593 was signed into law to build a new behavioral health teaching facility at UW Medical Center Northwest.
So we're extremely excited. We're extremely proud to be partnering with the state on this incredibly important initiative. And we're very thankful for the state for their willingness to help us and support the building of this new building.
The vision is for a state-of-the-art building. Currently, there are only 27 beds on the Northwest campus. This new building will increase that to 100 beds, serving geriatric, voluntary, and adult psychiatric patients, and civil commitment patients.
It will greatly expand UW Medicine's capacity to serve patients who need inpatient psychiatric care, but it'll actually become a regional resource.
It'll also be unique in how care is provided.
There will also be 50 medical, what we call acute care beds. And the reason we're building those beds is because many patients that have a psychiatric illness will also have a medical diagnosis that will need to be treated.
So patients can get their care in one safe environment.
We have thought that through the process of treating really psychiatric care from all different aspects of the patient's needs.
It's also preparing for the future.
It's called a teaching facility because the other problem we have in this state, we have a tremendous need for more workforce in behavioral health.
UW Medicine has the largest training program for psychiatry residents in the country. Not only will this expand that program, it'll also train other healthcare workers.
We will train nurses and nurse practitioners, we will train clinical social workers, we will train physical and occupational therapists, and we will train peer specialists who can work alongside other healthcare professionals to really provide great care for people who are living with behavioral health problems.
Good steady gait.
While there's more work to be done, patients are slated to move in by 2023.
I think the entire team really embraced the mission of this building, the need for this type of care, and are very excited to be a part of it.
And it's more important than ever to have a resource like this.
COVID's been such a tremendous stressor, but it's created a whole new group of people who've had really difficult experiences, who have really been traumatized by this. And I think we were going to just see a tremendous increase in the need. So I think that timing is actually perfect. So it couldn't come on fast enough from my perspective.
Well, good morning, everyone, and so happy to have you here today. I'm Cindy Hecker. I'm the Chief Executive Officer of UW Medical Center, and I am delighted to welcome you to our groundbreaking ceremony for our new UW Medicine Behavioral Health Teaching Facility. We would have liked to have everyone here today, but due to COVID, we wanted to ensure our top priority, which is to keep everybody safe. So for those of you who are watching on our live stream, our speakers are honored to represent you. And please know, for all of you that are on the live stream, that we are grateful for all of your support in helping us reach this incredible milestone. Over the past 18 months, I've had the extreme privilege of working with many of you on our shared vision, which is to improve the care for people with mental illness. As we come closer to making this vision a reality, I'd like to take a moment and thank many for their partnerships. Thank you, Governor Inslee and the Washington State Legislature for entrusting this vital work to UW Medicine and providing funding for the Behavioral Health Teaching Facility. Thank you to the University of Washington leadership for supporting this incredibly important project. And thank you to our labor partners who will help make it possible for the building to open up in late 2023. And last but not least, I'd like to thank the incredible project team, which includes Clark Abbott, our construction partners, SRG, our architects, the UW Project Development Group, and many UW Medicine staff and providers. This team has already spent hundreds of hours working incredibly collaboratively to complete the design phase of the project. And can I add, it's on time, which is great. And they have meticulously planned the work that is now ready to begin. As we prepare for the groundbreaking today, what excites me most is that we are really creating a new model of care for hospital-based behavioral health services. When the building opens, we will not only provide exceptional care for the patients and their families, but we will be delivering that care in a welcoming and healing environment. This building is also a vital training site for future healthcare providers. Thank you again for your participation today. It is now my extreme pleasure to welcome our next speaker, University of Washington President Anamari Kase.
Thank you so much, Cindy. You know, when I'm asked, what's the University of Washington's mission? I have a simple answer: to create the greatest possible positive impact. And with this groundbreaking, that mission of impact takes a big step forward. This marks a turning point in our shared commitment to addressing the very serious need for access to mental and behavioral health care across our state. I am so grateful to the many people, including all of you here on this site and the many more watching remotely, whose tireless work got us to this moment. You recognize that mental health care is health care, and that there are deep inequities in accessing that care. 41% of Washington counties don't have a single licensed psychiatrist. Low income and communities of color have the least access, yet they often have the greatest need. Today is a promise that, along with more beds and better treatment facilities, the training pipeline will expand, producing more highly skilled professionals dedicated to the kind of care that leads to healthy individuals and to healthy communities, including doctors and psychiatrists, as well as nurses, social workers, and pharmacists who will go out and serve every community in Washington state. This partnership between the University of Washington and the state is a wonderful example of how our public research university can partner with the state for the public good. I'm grateful that the governor and the legislature passed this legislation and provided the funding for this project. It's especially inspiring because it garnered support from both Republicans and Democrats in Olympia. Not an easy feat. Thank you to our legislative leaders from all four caucuses who have worked together to create a healthier Washington. And now it's my pleasure to introduce our next speaker, Governor Jay Inslee. Governor Inslee and his staff have been vital partners in this project. He had the foresight to include this concept in his budget proposal way back in December 2018. With everything on his plate right now, we are so pleased that he could be here today. So please welcome Governor Jay Inslee.
Thank you. Thank you. If I may add to that introduction, and proud Husky. Thank you, Mary. And proud Husky, proud dog. Go Dogs. By the way, we're going to help cougars here too, though. Let me make this point.
They have a lot of mental health problems.
I disassociate myself from that previous comment.
As do we.
This is a great morning in the state of Washington. We're celebrating the first Kraken wind in Washington state history. The beautiful rains have returned to the Evergreen State. But the things we're most celebrating today, isn't it great to be turning dirt on the very first teaching hospital dedicated to behavioral health in the history of the United States? This is worth celebrating. And I think that we ought to be able to be proud about this. This is a personal delight for me. I have been championing this project now for several years because it answers so many needs of the state of Washington, but it also is turning a commitment, verbal commitments, into actual concrete. And it is consistent with the next step of revolutionizing behavioral health in the state of Washington. We have done great work integrating mental health into our physical health system. We've done great work on that. We have done great work on breaking the stigma of mental health at its core and realizing, as the president said, this is health care. We have done great work trying to come up with a vision of distributing behavioral health in smaller units across the state of Washington, rather than concentrating it in just large institutions. But now we are taking the next step of actually producing the talent that is necessary to provide this mental health treatment with the institution of this hospital, and creating a whole new method of doing it, which is a dedicated hospital to this step. If you look across the United States, you will not find a better monument to the centrality of mental health care than this hospital right here today. So I do believe, like in so many things, we will show the rest of the nation the way forward in mental health care treatment with this hospital. So I could not be more excited about what's going on today. And let me note that this is something that unites us across the state of Washington. Mental health is something that's important to the young, to the middle, and to the aged. It's urban and rural. It's in every family. Every family needs mental health at some point in their large family gatherings. And so this is something that can really unite us. And I note too, it is something that is central to trying to reduce homelessness in the state of Washington. We know that if you ask any people in this state today, they'll tell you that homelessness is on the top of our agenda. But mental health treatment is one of the things we need to help people who are living and suffering homelessness right now. It's not the only thing, but it is one thing. So if you want to deal with homelessness, we should be celebrating the initiation of this school today. So I want to thank everybody who's been involved in this growth process. And now I get to exercise a great privilege as governor of the state of Washington. One of my privileges is if I meet somebody on the road that has really been truly inspirational, I can make them Washingtonian of the day. And when I do that, I can take off this pin I wear. This is the governor's Apple pin. And I can take it off and pin them on the Washingtonian of the day. Today, the Washingtonian of the day is a young leader who worked in my office who inspired me to put my shoulder behind this. And today, the Washingtonian of the day is Rashi Gupta. Rashi, come on up. You're Washingtonian of the day here. Rashi deserves this big time. She certainly inspired the whole executive branch of the state government to get behind this project. Rashi, thank you for your leadership. We really appreciate what you've done for us.
Thank you.
You mean a lot to us.
Thank you so much.
Thanks, Rashi. Thank you. She deserves a round of applause. Now I get to introduce a leader, not only this project, but virtually everything we've done in social services and housing for the last several decades. Frank Chop. Frank, come on up here and say hello. Thanks, Frank.
Thanks very much, Governor, for that introduction, and also for recognizing Rashi. Let's hear it again for Rashi. Jeez. You know, half of my speech is about Rashi, by the way, but because she used to work on our caucus, by the way, so it's a joint effort here. Thank you for allowing me to speak today. This is a great day for a great idea. We are here to celebrate and to thank those who have helped to make this happen. Thanks to Governor Inslee for including this in your recommendations to the legislature. Thanks to Senator David Frock and Representative Steve Theringer, who actually put the money in the budget for about $230 million. Thanks to Representative Norma Smith and Richard DeVolt, both of whom are Republicans who supported this in a bipartisan effort. In fact, this bill that we passed was passed unanimously in the legislature. Yeah, why don't you applaud to that, yeah. Also, thanks to Ian Goodhue, Joe Dacca, Jim Justin, and Lynn McComb for working the legislature to pave the way for this new kind of human infrastructure. And thanks to Representative Lauren Davis, who advocated for including substance use disorders in the very definition of behavioral health. It's extremely important. Thanks to Mary Clarkson, the House policy staff, who helped coax the concept through the legislature and legislative egos. Thanks to Cindy Hecker for working so hard to get this thing off the ground. And thanks, Larry, thank you very much for being here, but thanks to the workers who actually do the construction work to build this thing, starting in the cold and the rain. We very much appreciate that. Several years ago, this idea for a hospital came out of discussions of the Speaker's Mental Health Task Force that was later renamed the Behavioral Health Task Force. I asked Randy Revelle, former county executive, to actually start convening those meetings. Randy had his own struggles with mental health, if you remember that. At those meetings, he had lots of ideas that came up. One clear imperative was to change the whole dynamic in behavioral health and develop this new teaching hospital. Thanks to Rashi Gupta, Jurgen, others, and many others, that's why we took that idea and went forward with it. So I'm going to quote Rashi. Thanks, Governor, for introducing her. I asked her, okay, tell me how it actually happened in our task force. This is how Rashi describes it. We had been working with Jurgen for many years as part of the task force and heard him speak over and over again of the importance of providing all types of healthcare professionals, education and training that include an integration of general medicine with behavioral health. When we were looking to create much needed capacity for individuals with behavioral health needs in the community, the idea to expand that integrated teaching model to a broad group of students came to the forefront. The teaching hospital legislation focused on the two important goals: providing additional behavioral treatment beds and increasing capacity for behavioral health workers. Unquote. Rashi, you're amazing and so conscientious and a wonderful friend. Jurgen, I appreciate your hard work and your leadership for the entire state of Washington. And thanks to so many people, this is a great idea and a great project. But for me, this is very personal. Here at Northwest Hospital, my daughter was born and my father died. At the UW Medical Center, my sister was a patient at the psych unit in the UW Medical Center. For decades, she has been seriously challenged by what is called rapid cycling bipolar disorder. And one of the proudest moments in my life and in her life was her testimony to the State Senate Healthcare Committee in favor of legislation mandating mental health parity. She spoke very eloquently that day. I was crying in the audience. I couldn't help myself. Yeah, let's hear it from my sister Joanne. And we passed the legislation. My sister overcame many trying times and is living in Wallingford, thanks to the medical center, the health and disability insurance she had as a public school teacher, Medicare, a loving husband, and an extended family. And she had a home to go back to. For too many of our neighbors who are suffering with behavioral health challenges, when they are discharged from healthcare facilities, they are sent to the street where their health is endangered, they immediately suffer, and in many cases die. It's estimated that 70% of the people who are chronically homeless suffer from mental illness, substance use disorder, or significant physical disability. If having a home is critically important to sustain their health and well-being, then we should see homelessness in the context of health care. Today, we are celebrating a big step forward in the health care of our people. This new hospital will be a bright, beautiful facility for health care. But what if some of the people leaving this place won't have a place to go, a home to go to? So while we're congratulating ourselves today, let us look forward to the next big ideas before us. We should expand the state's Apple Health program to authorize doctors and nurse practitioners to write a prescription for a home. For those who need a home to maintain their health, relieve their suffering, and prevent loss of life. As part of that effort, we should allocate $400 million of unallocated federal funds to acquire and build supportive housing for our neighbors who are chronically homeless and need a modest home in order to live. We call upon all of you with us today to help create this idea of going forward together. The next legislative session starts in January. Thank you very much.
Thank you so much, Frank. Another UW alum. Go Dogs. Frank is very good and very appropriately wants to make sure that the credit for this is spread amongst an amazing, amazing team. There is no question it took a village to make this happen, but it doesn't without leadership. And I want everyone here to know just how critical Speaker Emeritus Frank Chop was to making this happen. No question whatsoever. The fact that he could speak to it from the heart and personal experience not only allowed this to happen, but played a big role in beginning to finally reduce the stigma of mental and behavioral problems. We all know it. We all see it in our families. But now we're beginning to build an environment where we can actually talk about it, which allows us to support each other. And now it's my honor to introduce another champion of this project and an incredible friend of the University of Washington and higher education across the state. Go Cougs! Senator David Frock. David, I know that this coming season will be your last in the state Senate. I still haven't come to grips with it. It will take time. But your approach to public service is just so incredibly refreshing. Your ability to get things done and to focus on getting things done has been incredible to watch. I am learning from it. And we're so grateful for your friendship and leadership on this project. And I hope that this project is one that brings you pride for many years to come. Please welcome Senator David Frock.
Thank you.
Well, thank you, President Cauce. You couldn't tell under my mask I had a big grin. So I appreciate very much those really kind words. And thank you for inviting me to be here today. It's a pleasure to be with you, Governor. It's always a pleasure to be with you. Madam First Lady, it's wonderful to be with you. I think what I want to, a lot has been said already about what this facility is going to be. Clearly, it's going to be a leading facility in the country, perhaps even the world, for training the workforce that we need. And if you talk to people who are delivering behavioral health services, our community health clinics, I talked to some just the other day with Neighbor Care, one of the key clinics in my district, not far from here. We're in basically North Seattle in my district. They are losing their workforce because of the challenges they're facing, the day-to-day stress. And this facility, this training hospital, is going to be transformational, and that's really been the vision that we've heard from Dr. Unitzer. And I want to thank you, because you are basically the politician whisperer of the state on behavioral health. You've got the ear of the Republicans, you've got the ear of the Democrats, and your vision is just so transformational when you come before us and talk to us about what we need to do and what we should be trying to do. So this innovative, integrative care that we're going to provide to patients with long-term behavioral health challenges will be transformational. And I thought I would just maybe, since a lot has been said, maybe take you back just briefly to the discussions that went on back in 2019, that session that we had. And Rashi had led a task force at the governor's direction on transforming the entire behavioral health system, a vision of community-centered care, as was mentioned, and the governor proposed this in our budget. And during that session, it was my first year, I believe, as the chair of the Capital Committee for the Ways and Means Committee, where we actually fund these projects. And I got a group of people together, Republicans and Democrats, in a room late at night. And I almost wish, I told people this before, I wish sometimes maybe the press could be in these meetings and they could see actually the give and take that went on. And we went around the room and we talked about the vision that you had provided. And there was little things here and there on the edges, but nobody really had any major complaints that I recall about what we needed to do. And the one thing that everybody was centered on was that this concept of a behavioral health teaching hospital affiliated with one of the, maybe the top medical school in the country, the University of Washington, was the thing that we needed to do to really jumpstart and change over the long term what our behavioral health system needed to be in this state. There was not a single dissenting voice, from the most conservative Republican to the most progressive Democrat, from east of the mountains to the west of the mountains where I reside. Everybody was on the same page. And that reflected in the fact that, as the speaker said, we had unanimous votes on the bill authorizing this and no dissents at all from the funding. I did notice there were 4 people excused from those votes. They came back later and said, what did I miss? They were unhappy that they weren't able to be there. And the reason was that everybody has this experience in their life. Everybody knows somebody who's had a challenge. Everyone knows a child who has anxiety. Everyone knows a family member who was suicidal at some point, or otherwise just was having a hard time and had needs that weren't being met. So one of the things that this facility is going to do, and this teaching hospital is going to do, is it's going to create a place for people to be stabilized when they're in crisis, when they're coming off the street, a problem we have here in this community. They need some place to go. They need to be stabilized, and we can help stabilize them here, and then hopefully as we build more housing and more services, more permanent supportive housing, facilitate rapid transitions to meaningful alternatives to hospital care so they're not boarded in the hospital, which is what we don't want. We're going to have clinical programs getting people into supportive living, as I mentioned. And another thing that's going to be vitally important to this effort is the fact that the University of Washington and this hospital is already a leader, but it's going to be even more a leader of 24/7 telepsychiatry consultation to those areas around the state where they don't have access to a children's psychiatrist, where the primary care physicians don't know maybe how to treat someone, a person who is cutting themselves and expressing suicidal ideation. They don't know exactly what to do or what the treatment they might need, or they may not have access to that. All of that can be done from this facility, and we're going to be the leader in the country, perhaps even the world. So this is really going to be a unique project. It's an amazing thing that the state has come together, and at a time when everything is so divisive and polarized, I am so pleased that we are here with a vision that I can truly say has support across the aisle, across the ideological spectrum, and something that's going to improve our state for the long run, for all of our people. Thank you very much. Thank you. Yes.
Wow. Thank you so much, Senator Frock, Representative Chop, and of course, Governor Inslee, for those incredibly inspiring comments. I would like to now introduce Larry Brown, who is the president of the Washington State Labor Council, AFL-CIO, which represents more than 600 local organizations and some 450,000 members, including members that will be working on the construction of the behavioral health teaching facility. Thank you, Larry, for your leadership and also for your partnership with UW-Medicine. Welcome.
Well, good morning, everyone. It's such an honor to be here. Hearing from the governor, Senator Frock, and Representative Chop, I've learned some things here this morning, but what I really know is that our community comes together when we have needs, and I'm so appreciative of that. Again, the Washington State Labor Council represents, a huge number of workers across this state, and one thing they all have in common is that their families all need the services that this facility will bring forward. It is an honor to be here with Governor Inslee and the Senator and Representative and President Anna Marie Kasse. Thank you for having us and inviting us. The Governor and the legislature understood that there was no shortcuts. At a time when there is a growing recognition of the behavioral health crisis that we face in this country and in this state, it was significant that our policymakers in Washington responded by investing in this kind of facility. Whether we're talking about the needs of our veterans who've been traumatized by 2 decades of war in the Middle East, or we're talking about the essential workers across the state that have experienced 2 years of a COVID pandemic that has impacted everyone, the need is real. Within the labor movement, for example, we're hearing from labor leaders talking about a frightful increase in suicide rates. This is traumatizing and frightening. And at a time of the growing need for behavioral health services, we know that there is a shortage of trained behavioral health practitioners. This facility will provide the space needed to grow that capacity and to produce a greater number of those providers. The Washington State labor movement has long understood the need to provide behavioral health services to our healthcare plans. And we are proud to have supported this facility, the workers who will build it, and the healthcare providers who will be educated here, as well as those who will teach and practice here. In conclusion, much has been said about the lack of job seekers in various sectors across the economy, including within the healthcare workforce. But I recently read about a solution to these shortages during a Zoom call. On the virtual background of one of our healthcare union leaders, it proclaimed, "Respect us, protect us, and pay us." As the president of the Washington State Labor Council, and in a total ripoff of that wonderful baseball classic movie, Field of Dreams, let me just say this: pay them and they will come. That means earnest collective bargaining for the people who will be working here. Congratulations to President Anna Marie Kasse and Cindy. Thank you very much. The University of Washington Medicine for your soon-to-be behavioral health teaching facility. Thank you very much.
Thank you very much, Larry. We really appreciate your words. And now I would like to introduce Rogelio Riojas. He is speaking today on behalf of the UW Medical Center Board. But Rogelio is also the president and CEO of CMAR Community Health Centers, a position he has held since 1978. Rogelio is a powerful advocate for those in need. Thank you, Rogelio, for joining us today.
Thank you, Cindy, and good morning, or should I say good afternoon, everyone. On behalf of the UW Medical Center Board, I want to add our thanks to the project team and to all the partners who are making the behavioral health teaching facility a reality. While much work lies ahead, as you all can see, we know that the project is in very good hands. As community members of the UW Medical Center Board, my colleagues and I have two major responsibilities. We provide oversight to ensure that the priorities, activities, and initiatives of UW Medical Center complement and advance the mission of UW Medicine to improve the health of the public. We also are responsible for assuring that high quality and safe patient care is provided at the medical center. With these responsibilities in mind, we believe the behavioral health teaching facility is a welcome and urgently needed addition to UW Medical Center. As a new model for community-based behavioral health, it will address the critical public health needs for more resources to care for patients and, very importantly, to train our future providers. Its design will improve both quality and safety of patient care. We also want to acknowledge that this project is moving ahead on schedule despite the many challenges of the COVID-19 pandemic. We know how difficult the past 18 months have been on our healthcare workers at UW Medical Center and throughout the community. At CMAR Community Health Centers, I have seen firsthand how the pandemic is creating new barriers, new struggles, and new fears for both employees and patients. Even as we hope to emerge from the pandemic, we can predict that an increasing number of people will need and benefit from the resources of the behavioral health teaching facility when it opens. At UW Medicine, we are very fortunate to have the expertise of Dr. Jürgen Unitzer guiding all our work to improve care for people with mental illness. As a leader in the field and chair of the Department of Psychiatry and Behavioral Sciences at the University of Washington School of Medicine, Dr. Unitzer has been driving force in planning for the behavioral health teaching facility. It is my privilege to invite Dr. Unitzer to the podium. Dr. Unitzer, and thank you very much for all the good work you do.
Wow. Well, thank you so much for the nice introduction. Thank you all for being here today. For many of us, this new beginning is the end of a long journey, a journey on which individuals living with mental health and addiction problems have been asking us for something better, something more hopeful. And in 2 short years, we're all going to be back here together to open a beautiful, safe, state-of-the-art behavioral health teaching facility. We're going to welcome patients, families, staff, and trainees to come together to heal visible and invisible wounds, to learn from each other, and to get and to give new hope. A modern facility dedicated to those struggling with brain health, mental health, and addiction problems. A facility that's going to inspire trainees from medicine, psychiatry, psychology, nursing, social work, pharmacy, physical and occupational therapy, peers, family members, and patients to work together in behavioral health. A facility that's going to make us all feel valued and proud about working in mental health. A facility that can address the full range of needs, including state-of-the-art medical and surgical care, psychiatric care, but also important needs such as healthy nutrition and safe housing. So I appreciate Frank bringing up housing. It's incredibly important. Let me finish with a big thanks to our partners on this journey, starting with Rashi Gupta, who's our Washingtonian for the day. Thank you, Governor. A huge thanks to Governor Inslee, who has made a powerful commitment to improving behavioral health care for our state. Representative Frank Chop, who sponsored this wonderful bill that is actually creating the foundation for this new building. Senator Frock and all the legislators on both sides of the aisle who heard the voices of patients and families in their communities and who have given us this opportunity to step up and build this beautiful new facility. And a big thanks to my colleagues at UW and UW Medicine, Cindy Hecker and the amazing team at UW Medicine and our partners in building this building for stepping up to take this opportunity, to take this challenge on. We are ready and we're going to make the most of this opportunity to build something really beautiful, really powerful for our community and our state. And I look forward to seeing all of you back here in a short 2 years when we open this building to offer compassionate and effective care and hope for patients and families and to train and inspire the next generation of behavioral health care workers for our state. Thank you all. And now we're going to have, I think, a few more comments on the video. So thank you all for being here.
Hello, I'm Nicole Macri, State Representative from the 43rd Legislative District in Seattle, home to the University of Washington Seattle campus. And it is my honor to congratulate University of Washington and UW-Medicine for this incredible milestone in the groundbreaking of the Behavioral Health Teaching Hospital. It has been my honor to partner with UW on this project, which will provide a teaching facility for the next generation of behavioral health professionals, and even more importantly, provide a community-based resource for the many families and individuals seeking behavioral health care at this time. So thank you for this tremendous work. It's an honor to work with one of the premier research and teaching institutions in our nation and one of the strongest behavioral health partners in our region. Thank you and congratulations.
Hi, I'm Manka Tingra, Chair of the Behavioral Health Subcommittee in the Washington State Senate. I wish I could be there in person with you to celebrate this tremendous step towards making our state's behavioral health system the very best it can be. On the ground where you stand today, in future years, hundreds of researchers will define the new standard for clinical excellence. Thousands of new doctors, nurses, and other providers will learn how to provide excellent, comprehensive, integrated behavioral health care. Thousands more Washingtonians will receive the treatment they need and deserve. This is not simply a King County asset, but our expanding telehealth options means that this place right here will touch the lives of people all over the state of Washington. Thank you to the visionaries who made this happen, the UW staff, the city, county, and state officials, and all of the community members who have been involved. Today is a great day for the future of behavioral health in our state.
Hi, I'm Senator Keith Wagoner, representing the 39th Legislative District and ranking member on the Senate Behavioral Health Subcommittee. It's a great pleasure to participate in today's groundbreaking. This is the beginning of what's going to be a giant step forward in confronting our behavioral health issues. And at its completion, this center will address three main deficiencies in our current system: capacity, workforce, and a change in how and where we provide treatment. There's going to be real help occurring at this facility, so it increases our bed capacity. But perhaps more importantly, it will train future care providers in the behavioral health field, which will be so important to supporting our efforts in expanding care closer to where people live.
Hello, I'm Dr. Ryan Kimmel. I have the good fortune of being the Chief of Psychiatry at the University of Washington Medical Center. The mission statement of the UW School of Medicine notes that we are dedicated to improving the general health and well-being of the public, and also that we are committed to excellence in biomedical education, research, and healthcare. I would like to thank the legislature and Governor Inslee for giving the University of Washington the opportunity to meet this mission by funding a behavioral health teaching facility. This building represents a commitment on the part of UW-Medicine to care for and foster resilience in a group of patients who are struggling with extraordinary medical, behavioral health, and social stressors. We will also use this facility to engage with the community, innovate, and educate successive generations of nurses, social workers, nurse practitioners, physician assistants, physical therapists, occupational therapists, peer counselors, psychologists, and physicians. Thank you.
Good morning, and thank you for joining us on this momentous day for the University of Washington Medical Center. I'm Charity Holmes. I'm the Assistant Administrator for Behavioral Health Services, and I have been honored to be part of the project team for the Behavioral Health Teaching Facility. It's been a tremendous experience to see this team of experts come together using industry standards, best practices, and expertise from prior experiences to make this state-of-the-art facility, focusing not only on excellent patient care and safety, but also on education and the reduction of stigma for behavioral health. My staff and I look forward to growing programs and providing patient care in this state-of-the-art facility. None of this would have been possible without the support of Governor Jay Inslee, the state legislators, and the University of Washington. Thank you all for your dedication and support of this project. It means the world, not only to our patients and staff, but also our community. I look forward to seeing the first patient enter the doors of the behavioral health teaching facility, and I'm counting down the days until that happens. And I know you all are too. Thank you again.
So you've heard now from our state and university leaders that this day, the start of this new construction project, is a momentous day. I could not agree more, and the excitement today is palpable through everyone who talked and through the entire staff that's behind us in those buildings. They are so excited to watch this building grow and to be a part of this amazing, amazing step forward for behavioral health. At this time, I am pleased to recognize two of our construction partners, Eric Olson from Clark Construction and Troy Stedman from Abbott Construction. They will be helping us break some ground. Let's get started and break the ground, everyone. So follow them, follow them. Whoops.
Okay, we'd like a husky shovel. Yeah, there you go. Excellent. Okay. Very good. Everybody know who's digging? Oh, there you go. Frank needs 2 shovels. You want to go back over? We've got another shovel here. It's okay. One extra. We missing somebody. You guys all the way over in the dirt here. We'll do the official shovel shovel. You're going to do the shoveling. We're going to go on the dirt. Break this ground. And I'll count down to 3, 2, 1. Okay, ready? Yes. Ready? Here we go. 3, 2, 1, and everyone shovel. 3, 2, 1. Go. Go, 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 go. Very good. You want to stand there for 1 second and lift the paint? Today I am the Washingtonian of the day.